Executive function is a broad group of mental skills that enable a person to complete a task and interact with others. An executive function disorder can impair a person's ability to organize themselves and control their behavior and emotion. So let's put in that way. The executive function is start to develop by age 2 and finish ending by age 30 and 35. Yes, so when a child in early stage cannot sequence one activity, let's say, the mother say, let's put your shoes on, yes, and the child doesn't think first, I need to put my socks, or I need to sit down, I need to find my socks, I need to take my socks, and then I need to put on, then I put my shoes. So I give an example for simple activities. So executive function is other skills. Remember, I said is mental skills is a group board of mental skills you need to be able to do on a task. Yes, so how to plan, how you organize yourself, how to do things in a sequence, and how to do things in a certain amount of time. So when you ask me how this executive function disorder can affect your daily life, affect a child, the way how he or she going to learn, how they're going to organize, and how they're going to interact with children. I give an example, very simple, in terms what I have today, a child. So this child came today and she forgot all the homework she needed to have for the school. And also, not she forgot the homework, she didn't have all the papers for the school. So she came today to the Elijah Center to review with one of our therapists. He working executive functioning. So we said to her, where is your materials? I forgot. Where is your homework? I didn't did. So little examples like that, you can see how executive function can affect the daily life of a child. Or when you have a teenager preparing for GCSEs or A-levels, when they don't feel motivated, when they feel overwhelmed with so many information, this you can see already the executive function deficits in the sense. We know people with ADHD often are 30 and 40% delay in development, which make them more likely to act motivated by short-term and harder than long-term goals. So what this means, a lot of children and people with executive function disorder is the lobe frontal and in the back of the brain is not working together. Yes, so we know that the back of the brain is where you store information that is already learned. The front part of the brain is where you use the information, this information to be socially effective, means how you perform a task and succeed in life. So this prefrontal cortex mediate executive function and it contains 4 major circuits. So the first thing is the what. What circuit controls my working memory? Can help you to execute plans, goals, specific steps needed to complete a project. So Usually you can see a child already having difficulty in working memory because cannot complete a task. So usually at school, the teacher is explaining what needs to do, and sometimes they can understand. However, they cannot deliver, they cannot transfer on a paper with sticking or cutting, because the motor planning is not there. Then what we can think, the when the circuit helps you to organize the order in which you complete activities and address timelines. So sometimes you say for a child, I give you 30 minutes to do that, and then we're going out, and you see your child or your teenager or young adult all day doing the same task, but actually sometimes they cannot start to do something, or they can't deliver in the same timeline than others. The why circuit controls emotions. So we saw here working memory, organization skills, and the emotions too. What you think about and how you feel. And the fourth circuit, I said, in terms of executive function, to have awareness about your feelings and how your feelings can affect others. So we see sometimes some of these adults, they can, let's say, jump through a situations, and sometimes they don't think about the consequence about their behavior, because instead to sequence and think, they perform in certain impulsivity way. So we see in terms of executive function, memory, planning, emotional regulation, or social skills are really delay in a person. So when we see executive dysfunction symptoms, yes, example, they can't keep in mind future events. They struggle together in terms to meet long-term goals. They trouble organizing their materials or setting goals or times or schedules. Trouble control their emotions and impulse. How they analyzing a situation, difficulties, and processing the information. So you can see how this can affect a young adult in a job or in a relationship with someone. Yes, so let's say you have a girlfriend and you say, yes, we're going to do this trip, but the person come late. For this happened with one of patient. He organized a trip and he came late to catch up the plane. So not only little things, but things that are going to affect daily life, their learning, and the interaction with others. We also see executive function allow people to do the follow activities like analyze a task, plan how to address the task, organize the steps, and to carry out the task. Like I said before, develop timelines for completing the task and adjust for shift the steps. How many steps I need to do something? And of course, complete an activity. I like always to give certain example. It's like you are doing diet, yes, but is your break, you want a coffee, your colleague want a coffee, then you go to a lovely bakery, yes, like a French bakery. So you go inside the bakery, you know you're doing a diet because you have a beautiful wedding to go, and you really choose to wear this kind of dress, but you need to lose 5 kilos. So you have your goal, yes. Then what's happening? You go to the bakery to buy a coffee, but when you see, oh, this beautiful little cakes with cream, with cheese. So the first thing here, you need to have inhibition to control your stimulus, to control your impulses. So the person executive function not going to have this inhibition. No, I have a goal. My goal is a long-term goal. I need to lose this 5. Going to say, oh, it's so delicious, so tempting. The second, when going to choose what going to eat, yes, what's happening next? Cannot do a planning. If I eat now, I not get. I need to avoid, I need to go quickly, I need to get my coffee, I need to move. So they freeze. They cannot stop and think. The mood is they freeze, they react, and they act in that sense. So this is a little example. A person in executive function cannot inhibit and cannot work with a long term because become very distracted by the stimulus they have around. The same is a child when need to complete a task, when need to remember their homework, when they need to do so many simple tasks in one go. When we have little children, yes, or toddlers, sometimes nursery or neuropediatrician refer to the Elijah Center because they see certain agitation in the child, yes, or the child cannot sustain on a task. They cannot do a puzzle, or they walk through an object or the toys on the floor, they grab things. So this is early symptoms we see in executive function disorder. And like I said before, some children have executive disorder plus ADHD. Yes, both comes together. So how we do? First, we do an assessment or a cognitive assessment. We use BAS with children to see in terms of inhibition and short memory. But we also, we have a brief, is another assessment we use for executive functioning to see in different areas, in areas of short memory, in areas of inhibition, planning, time management. We see non-work verbal memory, also verbal memory, in how the child perform a task, how also in emotional, in that sense, and how this person is self-motivated. So we need to use different techniques, different assessment, but not only assess in the center, we go or in the schools also to understand how this person behave. It's sometimes we have a lot of also information for the jobs, why they can't keep so many times the work in that sense. So we use really these two assessments. Yes, indeed. So, like I said before, if you understand what's going on in the brain of the child with this person, it's always good to know if you have a disorder and you have a developmental impairment, he's going to apply, he's going to have a problem in your executive functioning. So this is the self-management system of the brain. So early, you know, less you put this person to fail for the future, because executive function is all the skills you need to cope independent in life and to function in life. So you have cognitive behavior therapy. He's very practical. He's going to work really in terms of self-regulation emotion. We have also the PROCEED, Social Cognitive Intervention in Peer Group at the Elijah Center, where we work very close with the family and also with the individual, with the patient, in terms how to plan. So we divide small tasks and we set up what the importance it is in daily life, what is important in the performance in the school, what is important in independent school. So we work in tasks and we teach how to do by repetition. Also, we work in terms of role playing, and we set up this plan. We use a cognitive plan in all areas of the development where they can assess these two main areas of the brain, the front and on the back, in a very practical way.